Well, it's one of the big talking points this morning. Many hospitals have been forced to delay transplant surgery due to COVID-19. Annette Varrie has been waiting for almost 2 years now to have a kidney transplant. Her date for surgery has once again been cancelled. Let's speak to Annette now. She joins us live from Durban. Annette, good morning. Thank you so very much for agreeing to come on air and speak to me this morning. I know how sensitive this is for transplant surgery. How are you feeling? This is 2 years later, and still you're sitting here waiting. How are you feeling?
It is very frustrating because our life gets kind of put on hold. And while you're on hold, you don't know if any other health issues will arise. Would it be a couple of things? I had a blood clot already earlier this year in my heart from a port replacement in March from where I get my dialysis point. So you always sit and wait. What other issue will dive up while you wait for this process to happen?
And what were the specialists telling you? What were the hospitals telling you? Because I was always under the impression elective surgeries were obviously pushed aside. But what did they tell you?
Well, basically, because I have a live donor that we've been working together almost 2.5 years, that it is an elective surgery. And for me, that is just nonsense, because if there's a car accident today and somebody is a donor, they will transplant those kidneys and those organs into those people. And I'm not the only one waiting. I've got a bunch of people and groups that I belong to that are battling with the same thing. And I just wanted to create awareness, because it is so important for us to actually get our new lease on life and make sure we stay healthy, but we have to continue on dialysis because it just gets pushed out inevitably.
So I know we always talk about the world is on hold because of COVID-19, but your life has been put on hold, hasn't it?
100%. I can't do anything. I do feel for families that can't travel. I feel for anybody that needs any kind of surgery and can't do what they need to. But when it comes to life-saving surgery, whether it be for transplants or anything else for that matter, people should get put first. There's precautions. We don't take up COVID wards. We are special cases, and we can't be ignored and just pushed out like we don't belong anywhere or don't matter.
Help me understand, Annette. I'm sorry, you may have mentioned it. I might have missed it. Obviously, you're on a waiting list. There are those organs, a kidney in your case, that you will be able to receive at one point or another. What does that waiting list look like? How does this work now? Because the longer you wait, the less and less chance you might have of finding an organ donor. Is that fair?
That is the case for most people. I actually have a donor, which is a first country, which is offered to donate to me. And he's been going through various tests and a lot of stuff. So if you're on the waiting list, you can wait anywhere between 2 and 8 years currently for a kidney. I have a live donor. There's a couple of people that have live donors that are willing to donate to us, but they can't continue or finish the process. And specifically Durban, we're battling a lot here. And I even had people who moved possibly a transplant to Johannesburg, where they actually got more attention. I'm not saying Durban is bad, but obviously you see province to province, it is becoming an issue, and we're just finding that things happen in Johannesburg that doesn't happen in Durban, and like that. But on Friday afternoon, I got a message from my transplant clinic to stipulate that December and January transplants once again have been cancelled. And that was devastating. I was 7 weeks away from my surgery.
So what now, as we're going into the new year? Are you considering doing a Joburg move? Do you think that will make a difference? It's not fair, I realize, but is that something you can now look at? Is it even an option?
It could be a possibility. I have to consider, obviously, my donor as well. His family is down here, he's down here. And then how do we do the after-up checkups? So there's a whole bunch of things to consider. You can't just move provinces and just do stuff. You have to think about the whole bigger picture, because it's not about me. It's also about my donor and his family.
Lastly, government, we know, will be watching your conversation, you and I chat. Now, just before I say goodbye to you, Annette Varrie, what do you want them to understand? What do you want from them before I say goodbye?
I really would like them to pay attention to life-saving surgeries. It's not elective. It is what we require to continue life. And while we are healthy enough and our donors are healthy enough, we would really like the opportunity to take that surgery and better our life, get off a machine, try and live and work and do everything on a machine. It's not cool. And I know people are not always going to get transplants, and not everybody qualify for transplants. For those who give us the opportunity to do it, please, it's all I ask. Pay attention to the immune depressant, all people that need life-saving surgeries, give us a chance. Make special requirements.
You mentioned that you're part of groups, support groups, online groups, I imagine, Annette. I'll make this my last question. Where can people go to show support or get involved?
Well, currently I have polycystic kidney disease, so I have a polycystic kidney group. We have a Facebook page. We also have a WhatsApp group. I joined on there's kidney transplant groups on Facebook that I belong to, and I try and motivate and pick up people and try and speak to them as well, because people are not always in a good, safe frame of mind, and I try and uplift them as well. So WhatsApp and on a Facebook page, it's PKD South Africa, and also, as I said, transplant groups all over Facebook.
Annette, I'm wishing you all the very best. I'm sure next time we speak, it's going to be after you've had your transplant, after all this chaos is over. All the very best to you and your festive season, your family, and also your health. I'm sure we'll speak soon.